When will life return to normal?
That's obviously the question that everyone is asking. It's at least going to be several weeks. I cannot see that all of a sudden next week or 2 weeks from now it's going to be over.
That was March 20th, but then President Trump began to ask a different sort of question. How long can we take this?
Our country is not supposed to be built to shut down. You can destroy a country this way by closing it down, but you're going to lose more people by putting a country into a massive recession or depression.
So you've got public health experts saying we can't rush this or people will die. And then you've got Americans crowding beaches in Miami, in LA, parks in New York, looking at the cherry blossoms in DC.
This situation really contrasts with what we all think of as the American spirit.
Ryan Heath is global affairs editor for Politico, and he's watching how different countries are responding to this pandemic.
Do you think the president, though, is actually tapped into something? Like, is he actually listening to a segment of America that's saying we can't handle much more of this?
President Trump, he is very skilled at listening to his base, at understanding some of the undercurrents and the moods and the feelings that are not always on the surface of public discussion. So I wouldn't dismiss that he's tapping into something.
And again, this cure is worse than the problem.
Okay, so what is the president tapping into? Well, there's a brand new poll from Morning Consult which found overwhelming support, 81%, for continued social distancing to stop the spread of the virus. But when you look at the numbers by political party, twice as many Republicans as Democrats believe we should stop social distancing to stimulate the economy.
I do think Americans have a tendency to not feel they're really going to be touched by this kind of an invincibility to it.
Dr. Todd Dubose is a psychologist, a therapist, and recently talked to a group in China as they battled this pandemic. He sees big differences with our reaction in America.
What I'm concerned about is we're seeing this as a momentary irritation and interruption rather than something that's going to change how we need to be with each other globally. And I think there's a lot of pushback not to accept that.
But this virus doesn't see that. It just affects every human the same.
Correct. In the States, of course, we've had the kind of privilege that has afforded us an ability to put the primacy of comfort over everything.
So if for the first time in a generation, comfort is no longer a given for most Americans, how do we adapt?
This one does have a lot of onerous effects.
Dr. Jerry Jellison at USC studies change, and he says traditional approaches may not work right now.
So it goes thoughts, feelings, action. That's 2,000 years old, this model. What I've done is develop a way to flip it around. So instead of changing people's beliefs or attitudes, I focus on changing their behavior. Invariably, you start to have some positive experiences. And you discover, hey, the monsters aren't as bad as I thought they were.
So what does that look like? Well, let's say because you're not commuting, you have time to cook dinner or you have time to exercise, whatever it is, do more of that one thing and eventually your thoughts and your feelings should follow right behind.